I'm Dr. Linda Gromko, and this is Transgender Medicine Made Simple. Today's topic is, what are some of the symptoms of gender dysphoria? Well, first of all, let me give you a definition. This is my definition of gender dysphoria, that it is a type of physical and or emotional pain that occurs when a person's identified gender does not match the gender they were assigned at birth. And this can take on many forms. The most concerning of these are anxiety, depression, and even suicide. It's important to point out that the transgender and gender non-conforming communities have markedly higher rates of suicidal thinking and completed suicides than the average population. So let's go to the manifestations of gender dysphoria. In addition to anxiety and depression, here are some things that I've observed by listening to people in transition over the years. First of all, there may be discomfort with one's own body or parts of the body, and sometimes these feelings are much stronger than discomfort. These can be described as disgust or loathing parts of the body or the body in general. As an example, one of the trans women that I treat couldn't give me a urine specimen in the clinic one day, and it wasn't because she couldn't pee, it was because she was so uncomfortable simply touching the penis to give a urine specimen. Secondly, we see that it's very common for trans males to disguise their chests by wearing chest binders or a tight sports bra. This would be before top surgery. But they also may wear bulky shirts to hide their body. It's also very common to see trans males assume a hunched over posture to hide their chests. And this hunching can lead to postural back pain and shoulder pain, even though there's nothing wrong with the back and shoulders at all. Other discomforts include avoiding physical activity like swimming because it exposes the body. I can give you some interesting information about how to work around that at some other time. Many people will try to camouflage their bodies by wearing heavy clothing, even in the peak of summer or when extreme heat might make it uncomfortable or even unsafe for them to exercise. Secondly, people with gender dysphoria may dislike their voice, and this can be especially bothersome when speaking on the phone. I think this is because on the phone, people don't have all of the other gender cues that we normally use in real life. Sometimes this will lead people to have very hushed voices or even avoid speaking at all, which is a huge problem. Gender dysphoria can make many day-to-day activities very painful. Some of these would include getting your picture taken, going shopping for clothing. This is especially a problem with kids who've identified as a different gender and they're going shopping with their parents for school clothes, for example. Another time when this manifests is when people are going to events that have specific clothing rules or cultural expectations, and these might include family celebrations or weddings or funerals. Anything that has gendered expectations can be particularly difficult. Then we have concerns about being sexual. If you have gender dysphoria, using the sex organs that you have can be a source of conflict. For example, if you were assigned male, masturbation in the typical male style can feel too male, and it can even become a source of embarrassment or shame. So can interacting with another person in a sexual way. Some people describe this as being disingenuous or enacting a lie. And people, of course, find ways to manage this conflict. Sometimes people will address this through their own fantasy life, but sometimes people will avoid sexual activity altogether. So addressing these conflicts can lead to some very non-functional behaviors. For example, people may drink alcohol or use recreational substances to excess. They may use food in non-nutritional ways, eating too much, binge eating, restricting food, inducing vomiting to get rid of the food that was consumed. Doing any behavior, even if it's intended to be a coping behavior, to such an extreme that it becomes a problem can be an issue. And these include gambling, excessive spending, or taking an interest in a hobby to such an extreme that it causes harm in and of itself. We see self-harm activities such as cutting or burning. These are not uncommon in trans youth. I've even seen examples where kids have tried to cut off the breast or a testicle in a type of DIY gender affirmation, and thankfully this doesn't happen very often, but it does happen. There are many forms of dysphoria dysphoria that haven't made my list. I would appreciate it if people would write in to the comment section and tell us about some of the forms of dysphoria that I have not mentioned. In my next video, I will be sharing 6 things that have helped my clients reduce their gender dysphoria and live more comfortably. If you found this video helpful, please like it, subscribe to my channel, and share this video with other people who may need it. Thank you for watching, and I'll see you in the next video.